and put it in the air. So I think I bet Brooke filled you in, or you saw over email, but I'm writing this article for The Nation magazine about the new work requirement in the Medicaid program. Since Arkansas is the first state to actually have one in effect, talking about how it's gone so far, how it's impacting people, and trying to talk to people themselves just to see what the experience has been like. But I know you guys have done a bunch of work on this issue, and so I wanted to hear from you, just sort of from a policy perspective, like how it generally seems to have been going, what the biggest challenges seem to be so far, what's working, if there's things that are working.
Yeah, okay. That's a big question to get my arms around. So how's it going would depend on what your perspective is on what you want the program to accomplish. So not a lot of people are doing an uptake in work activities from what we've seen. So if you want the work requirements to get people to work, they seem like a failure. They are dropping people from roles. People are losing coverage. So if you think that decreasing Medicaid roles is the point of work requirements, then they're working exactly as planned. And if you think, Medicaid is for, and the legal argument obviously is that Medicaid is for like health coverage, and so these work requirements are kind of missing the point to begin with. So, obviously from our perspective as an advocacy organization, it's going pretty terribly. Just such a small, tiny percentage of people that have actually managed to report that they're meeting the requirements, versus all these people that, from the outreach that I've done, and not that, my job isn't outreach, so it's not like something I do daily or even weekly, but especially before these work requirements rolled out, I was trying to go around and specifically to the homeless population, because there's been, concern that just obviously it's harder to reach them with like some of these things, because like, for instance, the main way that DHS contacts people is through mail or email, and if you're homeless, how are you gonna get that information? But anyways, from doing that, it's just no one knows about the requirements. A lot of the outreach has been done like online or through Twitter, which really isn't helpful if you're not following like DHS on Twitter, which unless you're like a policy wonk like me, no one is, Right. It really just seems like one of those things that people are having trouble even knowing what to do, that they need to do anything, and then when it gets to the point of like, actually doing the work reporting stuff online, a lot of people are having trouble with that because, part of it is we just don't have a lot of internet access in Arkansas. So part of it's like tech literacy, but then part of it is like the design of the website. So for instance, going back to what I said, like the way that you sign up for this Arkansas Works portal, from what I've been told, is like they mail you physically like a PIN number, and then you take that PIN number and you sign up for your health care, and then you take that health care account and you go to a separate website that has a like your government work requirement account or whatever, and so then you need to link those two accounts and use this separate portal that's, so you're not just making them interact with this online system regularly, you're making them interact with it in a sort of like complicated and not straightforward manner.
Right. Oh my God.
And so a lot of that I would contend is just to save money, because DHS has been very clear, the executive branch in this state has been very clear that they think they can perform all these functions without any additional money. And that just, obviously that's not the case if you want to actually make sure that the program participants know about it,
Right.
So.
Yeah, has there been any funding put into either, outreach or supports for, work supports?
So work supports, there has been, not specifically because of this Medicaid work requirement, to be clear, but the Medicaid work requirements are designed to exactly mirror the SNAP work requirements, and after the waiver for SNAP work requirements sort of ended because employment rates came back down. Now we can go into that a little bit more if you'd like, but anyways, we have a federal grant that's specifically to help us build out and design our SNAP employment and training system.
Gotcha.
And so and I worked at DHS to help sort of design that program for a while before I came here. And so my strong perception is that, like, kind of their idea is that they've had this federal money to help them build this work requirement support system, like the online portal, and then also some money for stuff like, child care assistance or transit assistance, or like if you get a job, like, so all this workforce services stuff that they have invested some in, and they're getting federal money to help them with designing some of that stuff for SNAP. Mm-hmm. So I think their idea is that they got this money, they kind of have the systems in place, and they think that they can just duplicate it for the Medicaid population, kind of. Mm-hmm. But to that end, no, there's been no extra money specifically for this new population. Oh. So to be clear, it's like we have been doing some of this workforce support stuff that has been going on, but not specifically tied to this program. Yeah. And on top of that, we've kind of, from my understanding, this is a little bit before my time, but we've have like a statutory limitation on being able to use money for outreach on like this Medicaid expansion or healthcare ACA related stuff. Mm-hmm. So we've never done very much of that. DHS says that that's okay because we are relying on insurance carriers to do a lot of the outreach. Yeah. So the logic is that because we have this private option expansion where we're subsidizing people to have private coverage, so basically we're paying for like premiums for people to have private coverage using Medicaid dollars. Right. So the idea is that, if people start losing coverage, the insurance companies will start losing money, so they have an incentive to do all this outreach. And that's kind of, when I've talked to DHS about it, that's one of the things that's come up often, is that the carriers are doing it, like the insurance companies are doing that stuff.
Are they though?
Well, I mean, they say they are, and I don't really have a reason to think they're not. Yeah. I know that the Foundation for Medical Care has also been doing, they have like a hotline for assistance and that kind of stuff. Yeah. But I just, I think it needs I think it has to be a little bit more robust than what the insurance carriers can kind of do on an individual basis. Mm-hmm. Just because I think that, for a health insurance company, outreach to them is like probably just sending more mail or doing more phone calls, and really you need different channels of communication to hit the target populations that would be sort of problematic, I think. So anyways, I just don't, it's not that they're not trying, I just don't think they're not designed to do that kind of thing. So
because everyone I talk, well, not everyone, but a lot of people I talk to haven't heard about it or don't understand it, even if they have. So it just seems like there's, like, the biggest problem I'm encountering so far is not even trying to meet it. It's understanding that it exists and what you have to do.
Yeah, and that makes sense. And when part of that is just like, just like basic stuff that like health insurance is complicated anyway, like it's just a hard thing to understand. Yeah. We haven't made it particularly easy because we keep changing the program. Like pretty much every time we've reauthorized it, we've also asked for changes to it. Yeah. So we had the Democratic governor that originally passed the private option. Then we get a Republican governor who changes it to quote-unquote Arkansas Works, which it doesn't fundamentally change it, but it adds stuff like cost sharing. It has premiums on it. Some of that we abandoned and then moved to this work requirement thing. So not only is health insurance just complicated, we keep changing it. So why would it be easy for people to know? It's like, anyways, we just do, it's pretty hard to follow all that, even, as someone whose kind of job is to follow that stuff. Yeah. So if my healthcare relied on it, I'd be pretty worried. Yeah. So I think that's, a big part of it is just we keep seeking different waivers on the program as well. So
the workforce training stuff you're talking about for SNAP too, even if it's set up and people can know to go to those supports, like without funding, is it going to be able to accept more people in?
That's a good question. I don't. I'm frankly very skeptical about that. I think that if everyone that was losing coverage did come to them for supports, I seriously doubt they would have the capacity to deal with that. Yeah. But also obviously that they don't expect that to happen because they're not doing outreach around these kind of things. Right. Basically, they just are like, go to the website and there's resources that you can click on, which, that's true, but that's not very helpful. Yeah. So.
Yeah.
Right? I mean, because like technically,